kind of more into that later. And then just developing where do we have contaminated sites? And then through that, we can, work with public water systems near those sites, work on getting those sites remediated. And then also alert people that have private wells that could be exposed to PFAS, if we find contaminated sites. And really the whole thing's just about reducing exposure, and then working with anyone where we find levels above the health advisory. And then through regulatory authorities. So I'll get into some of that on these upcoming slides. John touched on this earlier, but just what we know about PFAS contamination and that's impacting drinking water in the state is just very limited. We have the systems down in the Security Wide Field area near Colorado Springs that detected it through EPA monitoring. We had a couple fire districts up near Boulder that just voluntarily decided to sample when they heard about these chemicals. And so they found that their own wells were contaminated. And then as well, and around the Commerce City area, just through firefighting foams and other activities. And the rest of the state is kind of a blank slate. So it's, we have areas like airports, landfills, military bases, lots of different things where we may have PFAS, but we just don't know. We haven't been able to go in and test. And so this is a huge project that we undertook. And so we were given $500,000 in emergency funding to find out, where do we have drinking water impacts from PFAS? And with this money, we were able to provide free testing for public water systems. And then we opened it up to fire districts that have private wells that would want them tested. And then we also did a handful of surface waters across the state just to see what we have in our surface water bodies. Normally these tests, are $300, $400 or more dollars. And so a lot of water systems, they were excited to be able to actually test these, and then also, have it all done at the same time where, there's some kind of unity for getting results and tackling the problem. So all of these test results we'll be actually sharing with the public on June 22nd. So the project is just coming to an end. The sampling is all done. We don't have the test results back, but as soon as we get them, we'll be working with everyone that tested, and then actually sharing the results on our website on June 22nd. And there's a link at the end to where you can actually see them. And we'll be working with, any systems, fire districts where there's levels of concern, and then we'll coordinate with local public health, EPA, and work with them to identify options to reduce exposure. So this has been our kind of typical response in the past. We've helped with community meetings and doing that. So we'll continue to do those if when we get these results back, if we have kind of levels that are above the EPA health advisory. And right now, this is just a screenshot of what we have on our website of a dashboard. And really this came about because as soon as we got the money to allow for free testing, it was purely voluntary whether a system wanted to sign up and have their water tested or not. And we were immediately getting questions, well, who's signing up, who's not signing up? And so we created a dashboard to just kind of be able to share that information. And so, it shows how many systems were eligible. It's about 895, 435 of them signed up, which is about half. And of the systems that signed up, it's covering about 80% of Colorado's population. So we had a lot of our large water providers sign up is kind of what that means. And below that, it just kind of shows where folks and what county they're in of where they signed up. And if you scroll down on that page, you can actually look at all of the different water systems. You can pull it up by, filter it by county, and then you can see if they signed up. And then when we get test results back on June 22nd, you'll actually be able to click on all of these water systems and actually see the test results that they have. So this is kind of how you'll be able to access that information. We'll also be putting together a map that shows the PFAS levels in the surface waters as well. So there'll be multiple ways to look at the data and download spreadsheets. So yeah, we're extremely excited to get all this back and see just kind of what we're doing, what we have in the state. Another big effort that's happening right now is that there's a narrative policy work group. And what that means is they're creating kind of narrative provisions in regulations 31 and 41, which are the groundwater and surface water regulations, to limit PFAS contamination entering the surface water and groundwater. And what narrative provisions are, I had to look this up when first kind of learned about this effort and getting involved. Is the narrative provisions are there to say you won't have toxic substances entering the surface water and groundwater. And so this kind of defines this policy as what are those? And what this means is it'll be implemented in the Colorado discharge permit system. And so what that'll look like is there'll be initial monitoring. So dischargers will have, fill out a survey. And then from that survey, could you have PFAS in your discharge? And then from that, those entities, there'll be initial monitoring. And right now, this is still draft. There's 25 PFAS species that would be being monitored for. And then there'll be continued monitoring for the entities that do show PFAS levels in the discharge, and then just kind of a further source investigation. If it's there, then where is it coming from? So some states have been really successful by kind of going upstream and identifying certain sources of where they're collecting kind of wastewater from, to be able to work with them to reduce the PFAS levels. And then depending on, through the monitoring, what the PFAS levels are, there could be effluent limits that would show up in a discharge permit. And so this will all be, the policy will be going in front of the Water Quality Control Commission in July of 2020. So right now you can go on our website, you can look at the latest draft. There's also, there's been multiple stakeholder meetings. So you can see from all of those meetings, what is all the feedback that we've been getting on these drafts, and then actually how are we addressing it. And so after every meeting, the actual policy has been getting kind of revised to reflect the feedback that we're getting back on that. And just kind of going into the meat of the narrative policy, it uses translation levels. And really those are kind of what could be used or considered if they're exceeded, to include as permit effluent limits. And really they're grouped just based on health effects. So if you look at that chart from EPA, we have PFOA and PFAS at 70 parts per trillion. And the main concerns, developmental impacts. And then, from other health studies and toxicity information, PFNA is supposed to be kind of, could be as toxic at those certain levels and have the same health impacts. And so PFNA is also included in that, along with parent compounds. So these are almost, you can almost picture them as larger kind of PFAS molecules that could be broken down and turn into PFAS or PFOA. And so, you know, the draft policy goes into specifically where all these came from and why they're being added. But those all added together would be 70 parts per trillion. And then PFHXS has a level 10 times greater at 700. And that's looked at separately because it has the kind of the end health effect is endocrine related. And then PFBS has a level of 400,000 parts per trillion, and the main concern is renal toxicity. And so that's what's in the narrative policy for the levels. And the other big thing that has become really of interest is just kind of this Firefighting Foams Control Act. And so this came about, other states had done something similar, and it's really trying to limit the contamination from these foams. And so, you know, off the military bases, the fire districts that tested in Boulder, lots of the contamination and where we've seen problems with drinking water is related to where these Class B firefighting foams that contain PFAS have been used. And so this bill just prohibits the use of PFAS foam in training or testing. So you can only use them on actual kind of live fires when they're needed. It prohibits the sale of PFAS foam by August of 2021, and then requires CDPHE to survey fire departments every 3 years. So we're required to survey all of the fire departments in the state, but it's voluntary on their part whether they fill out the survey. And the survey is just asking questions about, you know, do you use PFAS foam? How has it been disposed of? How much of it do you actually have? So it's trying to just get a handle on the amount of PFAS and the use of it in the state. So the first survey went out. The results were due on Halloween in 2019. And then we went through all of the survey results and came up with a report on January 1st, 2020 for legislature. And so, you know, of the 331 fire departments, airports, and industries, we had 89 that voluntarily responded to the survey. And in some of this information, this is all available on our website. I think it does a good job of summing up the results that we got, but not a surprise was most of the foam inventory we saw is with the airports, you know, and there's smaller amounts that the fire districts have. And then there was a question in there that I thought was really good that asked, you know, where can we help you as a state with this? And the responses, most of the responses indicated that people wanted to, you know, help identifying PFAS-free foams. So there's lots of folks out there that are looking into making that switch or have already done so, if they can. And then the other help that they're looking for is they have PFAS foams, you know, on hand, but knowing the health and environmental impacts, they really don't want those foams anymore. And so they're really interested in, you know, disposal of those. So that's where we're looking to see how can we dispose of these, you know, through future EPA guidance. And then also, can we get funding? And this is what John is, you know, downtown with, is, you know, is there funding that could help with a take back program to get these foams and dispose of them for the fire districts? So that's what's happening there. And John touched on the recent legislation. So these numbers are ones, the House Bill 20-1119 and then Senate Bill 20-218. Those are ones, if you want to write them down, you can go look them up and actually see the exact information and what's in those. And that's all we have. I guess happy to take any questions. I put a link to where you can get all of our PFAS information on our website. Easiest thing I found is if you just go to Google, not that I'm promoting Google, we're all on Google, but you can go to any search engine and just put CDPHE PFAS, and that'll take you right to our website where we've got all of these web pages available. And right now, with all of the test results coming back, we're just finishing up updating all of our web pages and providing a lot more health information and kind of FAQ documents for the public. So, definitely check back in a few days and there'll be a lot more information on our website. With that, I'm happy to take any questions.
Yeah, my name is Doug Cox. I'm a toxicologist who works for Sergio. You guys have talked about the issues down at Peterson with Whitefield security. Maybe you could talk a bit about how you've mitigated that, what was a complete exposure pathway, and what you've done in terms of providing safe water for the local residents or cleaning up the water down there a bit. Some background that would be great.
That's a really good question. And really, the military has actually done a really nice job, I think, of going in. So in the case of Peterson and those impacted communities, the Air Force has gone in. They've paid for the testing. They're actually paying for the treatment for the impacted water systems. And then they're doing kind of continual monitoring to make sure there aren't other impacts or the contamination plume is moving. And they're the ones, they're actually going in and doing remediation to clean up the actual site of the PFAS, so the actual source on base. And after this, they've actually gone in statewide and looked at all the different military bases where these foams could have been used and are taking groundwater and surface water samples to see if there's PFAS and at what levels. And then they're going off base where they see PFAS and doing sampling of any private wells that could be next to their property, any public water systems. So they're going off base to see if there's any contamination that's left the base, that could be of concern. And then they're providing treatment and paying for that where they do have impacted drinking water, and then dealing with all of the remediation on base. So as far as costs, they've really provided kind of the money for all of that, the impacts. It's a little different. Our biggest concern is where we don't have military or kind of someone to point to that's caused the contamination. So, in the for the fire districts that sampled, there was kind of some funding we were able to pull together and work with Boulder County to actually provide sampling and support for potentially impacted private wells in both of those areas. And then, that's part of why we're trying to bring in more state funding, is so where we do see impacts, we don't really want it to come down to towns or cities suing other towns or cities or folks to try to get money for cleanup or to deal with the high costs of drinking water treatment. And so we're some kind of fund to help these folks, and then with additional sampling is what we're doing. So does that answer your question?
Yes, thank you very much. Thank you.
You're welcome.
David, this is Joe Rubino from Stanley Consultants, and I think one of your slides I noticed you had mentioned how EPA is going to start requiring facilities to report PFAS on their Form Rs, the toxic release inventory reporting, and
Yeah.
so besides the firefighting foam that some industries and utilities may have on site, in your work, have you noticed any other potential streams that could contain PFAS?
Yeah, there's site like airports, landfills, and this is kind of nationwide where people identify potential PFAS sources. Discharges off of wastewater treatment plants have been identified. There's a list you can go online that includes kind of all of the industries where that could, race car tracks, things where they could use these foams there, certain manufacturing. I don't think we have a lot of that in Colorado. I mean, one thing that's we're interested in getting this data back because we want to kind of see where, once we know from testing where we have it in drinking water, to then go and see where could it be coming from. And so that, I think, will really give us a lot more information of what are some potential different PFAS sources we may have. I know one that gets listed, even from EPA, are ski resorts. So just the wax that you put on skis can contain PFAS. And so ski resorts are listed as a potential PFAS source. But then, studies I've seen over in Europe, it looked like it was very minimal from water samples and that they took near ski resorts. So some of this we're still really learning. We don't really know. We have, a few known sources where the military and folks have gone in, and we've really seen high levels near fire training centers and where they've been for putting out fires. But, a lot of this, we're still kind of learning where we may have it.
Sure. Okay, thank you.
Yeah.
Hey, Dani, this is Caroline Bice with Pinion Environmental. Thank you for your presentation today. That was very helpful. I had a quick question. I've been to some of the PFAS policy work groups, and there was a question from one of the larger municipalities or some concern about thresholds for PFAS in the policy and when PFAS is coming from sources that may not be that easy to identify, like for instance, not from foam and not from, fire departments or that type of thing, but from actual products that are being used by just in households. And it seemed like that was something that was interesting because, what would you do if you get a permit limit and you have to treat for these things? Are there certain treatments out there for PFAS, or how would a facility even attempt to address that?
Yes, right now, I mean, a lot of the removal technologies for a facility are, they're using granular activated carbon or ion exchange that's specifically designed to take out the PFAS, and then eventually you'll kind of exhaust what those products can absorb, and then you've got to change out the material. And the idea, there will be some PFAS probably just from people's everyday use and in the flushing of toilets and that, and what's coming off of kind of individuals. But at least like some of the research has just shown that beyond, that there'll be a level from that, but a majority, especially for places with high levels, it'll be coming from a certain industry or a certain source that hopefully could get addressed through through an investigation.
Okay, great, thanks. So there's really no expectation that the PFAS coming from household products and things would be something that would need to be addressed necessarily.
I mean, we're working, and this is, I think there's a lot of research happening on what products and how are we being exposed, outside of water, how are we exposing ourselves to PFAS and through what products? And so there's things happening to try to eliminate those PFAS sources, which, reduce our own exposure, but then reduce also what moves on, eventually could be to a wastewater treatment plant. Some of that, I know carpets, there's been, I think maybe the state of Washington and Home Depot has recently they've stopped carrying carpets that carry PFAS. There's a big push to try to get rid of PFAS in different kind of fast food wrappers and containers and some of that. So there's a lot of research to better understand what's in these products, and then also eliminating those that'll ultimately reduce kind of what we're exposing ourselves to, and then kind of passing it on into the environment. And so we're active right now, just seeing what's happening, what are other states doing, and what is the research showing of where, we do have PFAS exposure. Did that help with the question?
Yes, thank you.
You're welcome.
Hey, David, this is Garrett Clemens. You had mentioned earlier in your presentation that some entities, such as fire departments, are doing voluntary sampling of groundwater. So if their sample results come back with elevated results, where does that process go from there?
Right now, what we've been doing is, once we're aware, I don't know how many have actually tested and if they've, what they've done with their results, but if they've tested and they share their results with us. If they are of concern, we'll work with them, and then we'll also work with the county and the city that they're in, and then all kind of work together on a solution. And we've been able to help provide messaging to potentially impacted private wells in the area, and hold private meeting or public meetings with those folks and provide information, and then work together and with EPA to try to come up with funding to, further explore kind of options and reduce exposure.
Okay.
So it's really just kind of been a team effort.
Yeah.
Where we do find it.
Hit on my follow-up question was going to be funding available for cleanup. If there's a federal program or state program for entities who are voluntarily doing sampling.
Yeah, and right now that's what we're trying to really secure, is just funding for that. So John, what they're working on right now, that PFAS bill that he mentioned, is to bring in funding to provide remediation and to provide treatment and testing. We also have a few other things that we're working on that, to try to open up some funding and testing, working with EPA as well. They, additional resources and organizations that may be able to help us with sampling. So these would all be kind of, available, and we could work together and hopefully, if we did find impacts, we would be able to take some limited samples to identify who could be impacted and have those samples run at a cost that's not to a homeowner or someone who's kind of unfortunately just living in that area.
All right. Any other questions for David? All right. Doesn't sound like it. So, David and John, we just want to thank you for the informative presentation, and AWMA wants to also thank everyone that called in this afternoon. Thank you for your time. It was a great discussion. We appreciate everyone's time, and we look forward to speaking with everyone during our next AWMA monthly meeting. So with that, unless there's anything else from Sergio, we'll close out.
Yeah, no, that's it. Thank you very much, everyone.
Yeah, thanks for the opportunity to speak. Thank you all.
Yep. Thank you, David. Thank you, John.